Rafil Anbiya wal Mursalin wa ala alihi wa sahbihi ajma'in. Sorry ya. Apa nama, kelang kabut sikit, saya pun baru balik daripada luar ni. Lagipun rasanya tak sempat nak prepare apalah sangat untuk apa nama sharing hari ni. Tapi tak apa, kita cuba yang terbaik. Anyway, terima kasih kepada semua yang hadir pada hari ini. Dan yang pertama sekali saya mengucapkan terima kasihlah kepada organizer sebab initiate this thing, sebab yalah to get an overview apa yang nak dilalui lepas grad nanti kan. I believe that yang ni semua final year student ke? Okay. Susah sebab tak tengok depan-depan, tak tahu. Okay, tak tengok depan-depan, tak nampak. Alright, macam mana yang tadi Cik Pengurusi cakap tadi, nama saya Muhammad Hafiz bin Yaakob. Saya daripada first batch alumni dental faculty. Sekarang bekerja di klinik pergigian ibu tebal for quite some time lah. Now sebenarnya saya dah ditukarkan lepas ni ke klinik pergigian Sungai Bakap, Hospital Sungai Bakap untuk jadi YM di sana. So lepas ni saya bukan lagi lah YM di klinik pergigian ibu tebal. Klinik pergigian ibu tebal ni di Pulau Pinang tu, siapa yang tak tahu. Dia di daerah seberang Perai Selatan, which quite ulu lah. Untuk Penang ni, kalau kata klinik pergigian ibu tebal ni, ya agak ulu lah di Penang. Okay, anyway. Apa nama, saya rasa saya bukanlah orang yang paling sesuai untuk share apa yang pasal endo ke apa ke, sebab saya rasa ada lagi orang yang lebih layak. Sebab untuk cerita pasal benda ni is quite complicated now. So, benda ni keep on berubah dari tahun ke tahun. So untuk malam ni saya share je apa yang saya tahu dan apa yang actually perlu hampa expect bila dah grad nanti dan start kerja. Kalau ada soalan, feel free untuk ask kat mana-mana saja, to stop me kat mana-mana anyway. Tak ada masalah. I think yang ni pun very fast punya ni, tak ada apa pun slide ni. Sebab bila diminta untuk buat ni, saya pun tak tahu nak cerita macam mana sebenarnya. Saya pun korek dalam Facebook lah gambar-gambar ni semua. So this slides full of pictures, full of photos. Apa yang saya simpan dalam Facebook lah. Anyway, kita tengoklah apa yang ada lah. So I dedicate this sharing to my future colleagues. I hope that I can see you soon lah in the field. Alright. Saya pun tak tahu pasal sibuk gambar ni. Pertama sekali kalau kata gambar apa tengok dalam poster tu, jangan marah lah kalau kata gambar tu tak sama dengan apa yang hampa nampak tadi. Gambar tu it was maybe 20 kg dulu. So ni zaman bila tak ingat lah. As a bit of introduction saja nak tunjuk gambar ni, kok ada siapa-siapa yang berkenal dalam gambar ni. On the left picture tu yang tepi sekali gambar meeting Dental Student Club tahun 2010 ke 2011 macam tu lah. Waktu meeting Dental Student Club, and on the most right tu yang paling kanan sekali tu yang ada mata-mata James Bond tu, yang tu adalah aksia seni yang kita buat, if I'm not mistaken lah. First kali aksia seni. So gambar ni is big nostalgic untuk saya dan saya rasa ramai. Alright, anyway, untuk sebagai permulaan nak cerita, waktu zaman saya start kerja dulu, dia tak panggil endop lagi, dia tak panggil New Dental Officer Program. Waktu tu dia dipanggil sebagai First Year Dental Officer. Dia tak ada program apa semua. Dia lebih kurang sama, tapi yes, a bit perbezaan lah here and there. Biasalah bila start orang baru dia akan buat program baru, bila ada start masalah baru dia akan start dengan program baru lah. Okey, untuk pengetahuan semua, first posting saya adalah di Sibu, Sarawak. Di Sibu, Sarawak. Nak tahu saya sekali dengan Dr. Anurdin lah. Dr. Anudin Sabarudin. We were 5 of us. Saya, Dr. Anudin, Dr. Hadi lepas ni yang akan bercakap, Dr. Abdul Ghafur dan Dr. Hafizul Amin. So 5 orang kami, first posting kami di Sibu. Actually waktu kami bila akan melalui satu program yang dipanggil PTM lah. PTM ni sebelum kamu masuk dalam Jabatan Perkhidmatan Awam, kita akan dipanggil untuk khusus diberi penerangan tentang Jabatan Perkhidmatan Awam, apakah kita punya tanggungjawab. Sebab bila you dah pledge sebagai kaki tangan awam, you dah pledge sebagai penjawat awam ni di dalam perkhidmatan kerajaan, dia ada certain kriteria yang you kena follow, ada certain atas kerahsiaan yang you kena follow. So waktu di PTM tu kita akan diberi penerangan pasal itulah, apa kelayakan you, apakah kemudahan yang you akan dapat, and then apakah tanggungjawab you sebagai penjawat awam, apa yang tak boleh buat, your limitation and everything. So after PTM, yang PTM batch saya tu around 120 officers. Kalau tak silap lah 120 officers. Among that 120, I think dalam 20 orang ke tak sampai 20 orang yang kena ke Sarawak. Betul-betul. Other than that, mereka dihantar ke Pahang, Selangor, Johor dan kalau tak silap. Tapi 20 of us, kami kena hantar ke Sarawak. So, waktu tu, still young, Sarawak it is. Kami fly to Sarawak. Beli tiket waktu dekat PTM tu juga, kami fly to Sarawak. So, once in Sarawak, kami melaporkan diri di Jabatan Kesihatan Negeri Sarawak, di Kuching. And then, dekat sana, kami decide untuk stay together. 5 of us. So bila dia diberi pilihan, ada yang pilih Kuching, ada yang pilih Miri, ada yang pilih Bintulu, ada yang pilih Samarahan. So untuk Kuching, Miri, Bintulu dan Samarahan is quite a big city. Dekat Sarawak, bandar-bandar ni agak besar lah. So yang agak ke tengah, sebab dia Sibu ni is central of Sarawak. Dia tengah Sarawak. Di pertengahan Sarawak tu lah. So Sibu adalah central Sarawak, is quite hulu sikit lah. And then sebab orang lain tak mau, bila dah dibahagi tu ada yang 2 orang minta Kuching, ada 2 orang minta Samarahan. So tempat yang full 5 orang kosong adalah Sibu. So kami pilih Sibu. So saya, Dr. Hadi, Dr. Nurdin, Hafizul Amin dengan Dr. Ghafur tadi, kami decide untuk kami ke Sibu. Sebab apa? Sebab kami nak stick together. Yalah, waktu tu kami pun rasa sebab kita adalah first batch. Kita pun tak tahu what to expect. Tak ada siapa yang pernah cerita dekat kami apa yang akan jadi lepas tu, apa yang kami akan lalu. And then kita pun tak tahu tahap kita di mana waktu tu. So kita bodoh pun kita bodoh sama-sama. So kami pun decide Sibu it is lah. Satu cerita kalau nak share, tak ada siapa di antara kami ni yang pernah sampai ke Sibu. Dan most of us memang first time datang ke Sarawak. Nak dijadikan cerita, airport Sibu yang dekat situ tu, airport tu adalah airport baru. Baru pindah dekat airport tu. Kalau you boleh tengok, ada still lagi construction site and everything lah kat dalam airport tu. Dan kalau semua, dia punya time tu awal sikit. So malam dia awal. Especially dekat Sibu ni, kalau kata siapa yang pernah pergi Sibu tu, siapa yang pernah pergi kat kawasan tu, pukul 8 malam tu, kalau kat area taman-taman ni dah kosong lah. Boleh main bola atas jalan. Boleh tidur, boleh bergolek atas jalan. So waktu kami sampai ke Sibu tu, memang betul-betul pada saya lah. Memang cowboy betul-betul lah. Kami tak tahu nak call siapa, kami tak tahu nak pergi mana. Dan kami tak pernah expect yang airport tu macam tu. Sampai-sampai memang airport baru, tapi tak ada apa. Kedai makan tak ada, teksi tak ada, apa pun tak ada. Once sampai di Sibu, sampai-sampai kami solat, tengok-tengok semua orang kosong, tak ada apa, tinggal pekerja. Kami pusing kiri, pusing kanan, tak apalah kita tidur di airport. Nak dijadikan cerita, alhamdulillah, rezeki Allah. salah seorang daripada kawan kami ni ada kenalan dekat sana. Ayah dan kami dapatlah bermalam di sebuah rumah. Di rumah dia tu dia bagi pinjam. So daripada situ untuk lapor diri di pejabat daerah Sibu tu, kami berlima naik van sapu keesokan dia. Van sapu. Daripada rumah tu nak ke pejabat lebih kurang dalam 20 km lebih. So kami pun tak tahu kat mana pejabat tu, just kami cakap dia kata nak pergi bangunan persekutuan. Naik van sapu 20 km tu, kalau nak tahu naik van sapu tu dekat sejam baru sampai. Daripada rumah yang kami duduk tu ke pejabat. Dan daripada pejabat tu kami lapor diri dan sebagainya. Kita isi borang apa yang patut. The best part waktu kami sampai dekat Sarawak tu, sebab tiba-tiba datang 5 orang officer lelaki ke Sibu, Melayu. And then the SDO waktu tu dia really welcome us lah. Dia cakap thank you for coming to Sarawak. Thank you for coming to Sarawak. And then you all settlekan rumah and everything. Nanti hari Isnin masuk kerja. So itulah pengalaman sikit sebanyak. Which I believe rasa nanti kalau kata untuk yang batch yang kemudian ni, mungkin diberi pilihan untuk pilih klinik mana aku nak pilih. So kamu boleh pilih klinik belakang rumah kalau ada klinik belakang rumah. Kalau ada rezeki boleh dapat klinik belakang rumah, you mungkin boleh dapat klinik belakang rumah. Waktu kami dulu kami tak tahu dapat di mana. So kalau Sarawak it is lah. So tu sikit perkongsian. First time melaporkan diri ke Sarawak. Okay. Basically, as an introduction lah, bila first year yang kita bekerja ni, kita sebenarnya akan diberikan penerangan dan juga exposure macam mana primary healthcare ni, bagaimana perkhidmatan pergigian primer dijalankan di klinik-klinik pergigian primer di seluruh negara. So di klinik pergigian primer ni biasalah kita ada buat perkhidmatan pergigian di klinik pergigian. Selain daripada tu, kalau macam tengok ada gambar yang saya pakai baju purple tu, yang tu mungkin kat sini kita jarang dengar lah, tapi di Sarawak kita kena pergi masuk dalam kampung-kampung untuk buat program outreach untuk fluoride mouth rinsing and everything. Sebab dekat sana dia bukan pipeline yang macam kita ni, dia supply air, bukan macam kita. So untuk supply fluoride dekat sana kita kena pergi buat fluoride mouth rinsing. And then kita kena pergi incremental dental care, pergi kat sekolah, kita kena rawat murid-murid sekolah rendah, sekolah menengah. And now ada cadangan, sebab sebelum ni kalau untuk murid sekolah rendah selalunya jururawat pergigian lah yang akan cover. Tapi because of now kita ada surplus number of dental officer, kemungkinan saya pun tak pasti akan tukar role, mungkin officer pun kena pergi melawat ke sekolah rendah juga untuk buat rawatan di sekolah rendah. So yang tu adalah rawatan, kita buat lawatan ke sekolah lah. Ni adalah, kalau kata yang ni waktu ni saya berada di klinik pergigian Oya, Jalan Oya, Sibu. Okay, basically ni adalah program yang lancarkan pada 2017. Sepatutnya awal lagi dia buat program tu, tapi there's a hiccup tahun 2017. So sejak daripada 2017 ni, sebab kita nak start sebelum tu still adalah permanent, masuk pun permanent, so dia tak start lagi program endo ni. Before that 2016 saya start dengar pasal program ni 2015 lah, 2016. Ingatkan 2016 nak buat, dia offer permanent post kepada semua yang masuk bekerja tahun tu. So dia tak start lagi program endo ni. And then dia start pada tahun 2017 start dengan contract officer. Bila dia start buat contract officer, dia start dengan program endo. Dia dah stop program Fido tu. So tak ada lagi lah you all dengar Fido sheet dengan Endop. Endop tu macam saya cakap tadi adalah new dental officer program. Kalau you masuk bekerja nanti as an officer, kita akan panggil you endo. endo, so new dental officer. Basically sebenarnya new dental endop ni dijalankan selama setahun saja. Setahun kan semua apa-apa yang dulu attachment dengan pakar ke, attachment dengan ni apa semua dikurangkan kepada 2 specialty saja, iaitu OS dan juga PITS. So program ni dijalankan selama setahun sebagai satu exposure kepada pegawai tentang apa yang dijalankan di primary care. Itu primary care yang paling panjang lah. So dia punya base di primary care, and then daripada primary care dia akan pergi attachment untuk oral pediatric PITS. Tapi tempoh dia kalau tak silap saya sangat pendek lah. Lebih kurang dalam sebulan macam tu saja untuk each attachment tu. So dalam sebulan tu you kena campaign and everything lah. Alright. Okay, gambar ni mungkin ada siapa yang kenal-kenal ni. Yang ni pun korek dalam Facebook juga. Kalau nak tahu beza Fido dengan Endop ni, waktu saya Fido dulu, kita akan attack daerah tu ada attachment, ada pakar, semua kepakaran, ada pakar resto, ada pakar auto, ada pakar pits, ada pakar tu, kita akan rotate. Kita akan rotate dalam daripada pakar ni ke pakar ni ke pakar ni macam tu. Kita tak ada base. Dia selalunya waktu tu, dulu dia tak ada base lah. Dia tak ada, macam you duduk di klinik sekian, lepas tu you keluar pergi attachment. And then you balik ke klinik base you. Tak. Waktu tu, majority daripada orang yang bila program Fido ni, you tak ada base. You masuk ke primary care, you pergi ke kepakaran ni. Itu you jump ke kepakaran ni. You jump ke kepakaran ni. At the end of the day, bila you dah habis semua tu, dalam around 1 tahun, and bila you dah nak jadi permanent lah, maksud dia you dah habis Fido setahun tu. Habis Fido setahun, dia akan nama dia permanent posting. Bila habis daripada Fido setahun, you dapat permanent posting, barulah you dapat base. You pergi ke satu klinik yang you akan stay dekat klinik tu. Okay. Berbeza dengan Endo, satu base klinik. Satu primary klinik, you duduk dekat klinik tu, dan you akan keluar daripada klinik tu untuk pergi attachment dan balik ke base you. So, yalah, sebab attachment pun dah dikurangkan daripada banyak-banyak tu kepada 2 attachment saja. So, you akan banyak duduk di klinik base you. So, kalau you lapor diri, katalah you lapor diri ke klinik pergigian nibung tebal, you akan berada di klinik pergigian nibung tebal, and then keluar pergi attachment, balik ke klinik pergigian nibung tebal, stay dekat klinik pergigian tebal sampai masa cukup setahun, habis you punya compulsory service, you nak keluar, you keluar. Kalau you nak terus, you habiskan kontrak you sampai disambung untuk masuk ke permanent post. Cumanya sampai ke hari ini, permanent post yang dioferkan sangatlah limited. So, sagilah kita sembang yang pasal sangat limited tu, susah nak cerita dekat sini sebenarnya. Benda tu banyak lagi benda yang, tapi tak apalah. Yang tu buat macam mana, bukan dalam kita punya kontrol. Apa yang saya nak bagi tahu sekali lagi, ada apa yang perlu hampa expect lah bila dah start masuk nanti. Berbeza dengan saya punya Fido dulu, program kat Sibu sangat-sangat berbeza. Bukan takat dengan program Endo saja, tapi berbeza dengan Fido waktu tu juga dengan kawan-kawan yang lain. Waktu dekat Sibu dulu tak ada kepakaran lain selain daripada primary care dan juga OS. So apa yang rotation dia buat dekat sana adalah 6 bulan berada di pergigian primary care dan 6 bulan berada di hospital base. So saya menghabiskan masa 6 bulan di klinik pergigian primer. Bulan nak dijadikan cerita lagi, sebab waktu kami nak permanent posting tu, post tak dibuka lagi, post tak ada. So kami spend around 8 months months lah, lebih kurang 8 bulan. Lebih daripada biasa lah berada di hospital base. Itulah beza yang sikit sebanyak lah. Basically, tapi exposure yang berbeza lah. Sebab waktu Fido dulu, dia di expect you untuk stay. Waktu I tak tahulah, mungkin sebab dia tak expect you to stay, so dia bagi less exposure. Mungkin, ataupun sebab surplus number of officers banyak sangat. So tu antara sebab lah. Antara sebab yang paling besar sekali adalah sebab number lah. Number of officer yang sekali masuk sampai berapa banyak. So dia tak boleh nak cope with the attachment punya time tu, period tu. And then dia pendekkan supaya at least semua orang dapat sikit sebanyak exposure lah pasal apa yang terjadi. Sebab pada I, hospital dapat primary care. So you kena juga pergi dapat exposure kat sana. Alright. So basically bila you masuk dalam program endo ni, you akan dapat logbook juga. Macam yang fakulti sekarang ni. Tak banyak beza pun. Tapi you don't worry about this lah. Dia akan dapat nanti, you akan masuk-masuk, you akan dapat 3 logbook. Logbook yang pertama adalah 1A, 1B, 1C. Yang gambar dekat sini ni logbook 1C. Logbook 1C ni adalah pediatric. Yang lagi satu tu 1A, 1B adalah primary care 1A dan oral maxillofacial 1B. Tapi you don't worry about the logbook yet. Nantilah you akan tengok logbook tu. Saya tak pasti nanti bila kamu masuk nanti adakah akan pakai logbook yang sama ataupun tak, ataupun kita ataupun tak. So dia adalah gambaran pada masa sekarang, pada tahun ni. Saya tak tahu awak akan dipanggil nanti lepas habis exam, lepas awak grad, bila awak akan, benda ni dah berubah. So don't worry about this. Don't worry about this. Tapi cumanya awak kena simpan dalam kepala yang still ada lagi logbook. Bukan habis belajar, dah tak kerja, tak ada logbook dah. Logbook ni, dia bukannya untuk cakap kata you bagus. Kita just nak monitor sebenarnya. Bila kita nak compare dan kita nak bagi markah, so kita kena keep satu record. So record ni lah yang kita nak tengok. Sebab bila kita nak pilih, kita kena pilih a competent officer. Tak semestinya bila you grad, you are a competent officer. Macam tu. So a competent officer, you tunjuk cara kerja you tunjuk macam mana you kerja, macam mana skill you and everything. So kita record dalam logbook ni. Tapi at the end of the day, the logbook itself tu tak ada lah portray who really you are. So sebenarnya dia ada lagi satu borang yang kita kena isi belakang ni. So tak apalah, yang tu kita cerita yang pasal lagi satu borang tu. Pasal logbook ni je nak bagi tahu dekat hangpa. Nak bagi tahu dekat hangpa yang pada saya rasa ramai officer yang lack adalah mereka tak tengok patient tu as a human, luar equation human tu dalam cerita ni. So patient centered care ni, behavioral science is very important. We have to make sure that we see patient as a person with feeling. And so this one I quote from the Datuk Wan lah. So bila buat kerja apa pun, make sure yang you put human dalam tu. And mungkin apa dah pernah dengar means altitude. So yang itulah maksud saya satu lagi borang tu. Kita akan assess you on attitude. So apa tak peduli lah apa yang program yang akan apa. The most important part is you jaga you punya perangai. You jaga punya attitude. I ingat lagi pesan daripada Datuk dulu. Waktu kami first nak grad, Datuk kata kat kami as a first batch, Datuk kata jaga perangai you. Kalau kata you dah buat perangai, nanti semua adik-adik ni akan tertempias dengan apa yang kami buat. So itulah antara kata-kata yang kami pegang ke hari inilah. Tak maulah nak merosakkan nama fakulti kita. So bila dah masuk kerja nanti, yang ni gambar ni saya tunjuk sebenarnya just to show that you kena be good to everyone lah. be good to everyone. Yang ni nak abang kata as an officer, you boleh join dengan siapa-siapa pun dekat situ. Sebab everyone dekat situ menjalankan kerja yang sama. So teamwork ni penting lah. Bila you nak bekerja nanti, you akan bekerja dengan pelbagai lapisan staff. Dan hubungan you kena jaga tu berdasarkan attitude you lah. Kalau you baik dengan orang, so orang akan baik dengan you. Tu yang penting. Satu aspek ni tak ada apa, ni saja je. Nanti bila dah ada peluang untuk masuk ke bidang pekerjaan, you jangan stay dalam apa je. You have to go beyond that. So benda tu pun orang akan nilai kesediaan you untuk buat something yang lebih daripada kerja you. So macam ni di Sarawak, I join IDD manager je lah. Alright, so tak mau ambil masa yang banyak. Ni pun dah lebih lagi orang lain nak cakap juga. Learning point yang boleh nak bagi tak, bila dah start kerja nanti, jangan stres-stres, enjoy the process. Belajar. Just enjoy the process dah. Apa yang disuruh buat, apa buat. Experience the process lah. Sebab proses tu dia might hard for someone. Kalau kata dia ni mungkin ada, for some memang dia tempat yang agak difficult lah. For some dia mungkin lalu tempat yang bit lenient. Tapi just enjoy the process lah. Nanti bila dah masuk, bila hampa dah tengok tempat kerja nanti, just enjoy the process. Hampa habis compulsory service tu. Number 2, be humble but not weak lah. Be humble but not weak. Be humble but not weak ni sebab nanti in a real world tak sama macam lalu law di fakulti semua kawan-kawan masing-masing. Hampa bila masuk dalam real world nanti hampa akan jumpa macam-macam jenis orang, macam-macam jenis kawan. So tak payah nak koki sangat. Orang lain tu mungkin salah ataupun orang tu buat tak betul ke apa ke. Just be humble but not weak. Jangan biar orang bijak kita. Number 3, make sure that yourself and independent. You jangan manja sangat. Yang itulah pesanan dia. Jangan manja sangat. Nanti bila dah masuk kerja, sikit-sikit nak ni, sikit-sikit nak ni, sikit-sikit nak pergi report, sikit-sikit nak tanya, sikit-sikit nak ni. Independent. Macam mana you nak jadi competent, you kena confident, you kena know your knowledge and everything. You kena tahu you punya dentistry ni dia punya bread and butter, and knowledge tu you kena kuasai semua. Baru you confident and competent. And independent ni you kena buat decision you sendiri as long as you think that you are. So you boleh ni lah. So at last, willing to listen and willing to learn. Kebanyakan orang dia tak mau dengar apa ni. So you all the best. Kalau ada soalan boleh tanya.
Okay, terima kasih Dr. Hafiz. So sekarang kita buka Q&A session. Kalau audience ada soalan ke, boleh buka mic ataupun drop question tu dekat chat box.
Ada soalan? Ada soalan? Sorry lah kalau tak faham.
Ada soalan dekat chat box satu Dr. Nak saya bacakan?
Apa soalan tu?
Soalan dia, Doktor, requirement and doctor achievable jika Doktor?
like just now lah, sebenarnya don't worry about the requirement lah. Don't worry about the requirement. Requirement tu macam saya cakap memang untuk tengok you punya kompetensi saja. And then as kalau kata bila you cakap you competent, kita nak kasi proof lah kan. Yang tu satu kita nak bagi markah dekat you. Yang lain tu don't worry about requirement. Requirement tu sebab everyday job kita. Dia akan memang hari-hari kita buat benda yang sama. Kita buat kerja tu. So dia adalah partly exception. Macam tu ada ni sikit. Yang tu je lah. Kalau achievable, yes achievable lah.
Ada siapa-siapa nak tanya soalan lagi ke?
Aduh Nazrin, kena bully lah. Biasalah. Macam saya cakap tadi lah, ada orang yang kena lalu fasa tu in a bit difficult way. Kalau ada setengah orang mungkin dia lalu dengan senang. Just be versatile and resilient lah. Tu yang penting. That's why I cakap attitude yang penting. I think kalau tak salah boleh pass tu Dr. Hadi kot. Dr. Hadi dah tak sabar tu.
Okay, kalau tak ada soalan, kita proceed to the next speaker. Okay. Thank you, Dr. Hafiz, for such an insightful sharing. Now let us move next. What is it like in pursuing your studies in postgraduate studies? How about being a specialist in periodontics? Lively coming far away from Copenhagen, we have our Dr. Muhammad Hadi Muhammad Hanifah with us for our second session. So Dr. Muhammad Hadi is our alumni from the second batch, and he is now studying his postgraduate studies in periodontics in University Malaya. Let us invite Dr. Muhammad Hadi Hanifah. Doctor, the stage is yours.
Hello, Assalamualaikum. Can everyone hear me? Sorry, a big correction there. Actually, I'm the first batch along with Dr. Hafiz, Dr. Anuddin, and Dr. Gafur, and also Dr. Hafizu, which are currently. So, okay. Is it clear? Because here is a bit windy.
Yes, clear.
Yes, very, very good. So thank you, moderator, and thank you to the committee for inviting me to share my experience and my journey of getting there as a periodontist.
Dr. Hadi silau lah tadi.
Silau. Ya. Macam ni okey. Tengah jalan di sini.
Better.
Ni better Tak nampak background black. Don't worry, bukan kat pantai. Okay, siapa yang handle saya punya slide boleh next slide. Thank you. So basically, the next slide is my outline of presentation. My journey, how I did my how I choose the specialty, and the next point is just to racun everyone. Try to influence everyone what experience that and then how to become one. And as a periodontist, I will be shorten the form as perio in Malaysia, and in Malaysia as well. So next slide is a bit of my journey. Laju ni dah belakang lagi. This is basically like we graduated in 2012 as a pioneer, and this is the 4 of us. I mean the 5 of us. Not sure, but this is the Borneo team lah. Basically the guys that went to Borneo during our FIDO. Inside there, beside me is Dr. Hadi, currently a successful general practitioner, CEO for his company in Penang. Our clinic and the clinic later if MOU to Penang, you can go and visit him. Perhaps you can share his knowledge as well. There beside me is my wife there, supporting me and bring me to Sarawak as well. Okay, next slide. So even though we are 5 of us in Sarawak, but apparently the 4 of them first posting is to the primary care clinic and leaving me alone into oral surgery department in Hospital Cebu. It's quite a painful journey actually, because everyone trying to avoid Hospital Cebu is for certain reason. We accept the challenge and go there and plan to stick 5 for us, but then the outcome, and I mean, Allah put me alone in Hospital Cebu while Hafiz, Anuddin and Ghafur went to primary care clinic in Cebu and Lanang. So here one requirement there in Hospital Cebu is the surgeon there tried to push us to present our poster. Basically, I presented my undergraduate with Dr. Ella and my team. So we presented there. Everyone there also presented the poster there because the surgeon one train us from the public to be criticized by anyone that interested with our research and findings. So this my team in Cebu before I left. So I also went to Clinic Kapit to relieve because at that time everyone so we are shortened of officers. So I have to go there and cover the clinic there for a while. And it's like so, and then in 2015 I went back to Kota Baru. At that time, because in Cebu I only have oral surgery training for 6 months, and at that time where the April our surgeon there really torture us with surgery, so that's why I took over a more interesting surgery. That's why I went for radio, but the one on board. So after I went back to Kota Baru, I attached with Dr. Hani Kota Baru for 2015. And I also an officer in Jalan Mahmud, Kota Baru. If anyone of you from Kota Baru, it's near the stadium. Very basically, it's called active car function. So really from Padang for a while, but I mean, this is the very next slide. So in 2017, I had specialty, which is in for a KM. Is something that most they to take time, and it's an offer which very well because it's for the study, and some of us only have specialty without cuti belajar bergaji penuh. I was awarded with cuti belajar and bergaji penuh as well. And then I started my day 1 UM as a value, and now 2020 is where I'm currently the final year. This my friend picture here is during that time, my personal exam was during the COVID time, the COVID era where everything is online. So we passed our exam, alhamdulillah. Examiner Dr. Leong from Hong Kong. You see, perhaps the Prof. Haslinda knew him. So we are only 5 of us guy here, and below is me presenting my poster in Copenhagen recently. Next slide, please. So specialists, I think everyone here know what perio do, because we have an amazing lecturer here in USIM, Dr. Anuddin, Dr. Aiman, Dr. Azriza, Prof. Haslinda. And then basically we are specialized in tooth and implant supporting structure, mainly the pink aesthetic and also the hard tissue, bone. So this is where we deal with. And maybe in a research part, we may play around the microbes and also host rescue. Okay, next. So yeah. Okay, why this? If you ask me that healthy perio is the foundation for any other dental treatment, you cannot proceed auto if you have an healthy perio. And it will be deteriorating for the patient if you start auto and without checking how patient is the gum health. And then in implant gingiva, if you take any impression, very poor impression, and you may end up having implant disease. You place an implant. Okay, this is basically why I took perio, because basically this is the foundation of other dental treatment. And in UK, in this Europe, and before they start many other treatment, before they start crown, before they start bridge, before they start the implant, before even denture, ortho, they will check. We send for cleaning and send to perio specialist to settle down the perio, reduce the inflammation or stop the inflammation, and then proceed with the department. Okay, next slide. So this picture shows this called as one S. So you can see that missing tooth, inflamed gingiva, or in the lower incisor. In the upper one is actually mobile with some root resorption and a bit out of the alignment. You can see some on the opposite picture. And then next, and then after 6 weeks, after non-surgical therapy, we can see the color become pinkish. I mean, a bit slight red compared to the earlier within the baseline. And then we also give her immediate denture. So supposed to got a picture with her denture lah. She planned for implant later on, but it gave us. But currently, she's under orthodontic treatment after her perio is stabilized. She's actually 44 years old. Orthodontic treatment is not only involved around children or school children, but you also do adult orthodontic. Sorry, bising. Dengar tak? Hello? Next slide.
Dengar doktor.
Next slide. Next slide. Okay, with the denture lah. Okay, selain pada tu, perio ni it's not all about scaling and root surface department. Starting with sampai 2 weeks post-op. One of my graduate actually basically patient is to orthodontic treatment. She already finished the orthodontic treatment. She's a 20 years old lady. She a recession on her K1, I think. But she is afraid of a recession and not happy with the looks. So we tried to soft tissue by using soft tissue magnetic tissue bra. Taken from a hard palette, bring it down, and then K1 the bottom. Using this cross suture. So you can see if after 2 weeks pop out, so part of scaling and cosmetic development, periodontitis also soft tissue. Okay, next slide. So this is actually not my picture. This is taken from Instagram for account. So basically, for this case, it's actually where you can see some bone I mean, she's not adequate, and in order to place falsity, may not like that pleasing aesthetically, and more perhaps patient doesn't need. Maybe Dr. Nadia can put some pink composite, pink porcelain to cover the gum area. But here, since the patient wants to go for surgery, then bone and region the bone. And next slide. So this is patient in order to place an implant, because tissue doesn't it is inadequate and the bone is not adequate, so we can add some bone and add some tissue in order to place some implant to make that is more aesthetic. All right, so next. So perio is not all about surgery actually. Like I mentioned earlier, clinics, then you can do surgery. If not, you can become a microbiologist and also go into immune host response, because currently my research paper that I did in UM, the expression of inflammatory and healing biomarkers following use of antimicrobial peptide gel. Basically, because currently emerging new knowledge on perio disease, currently still debating whether it is a bacteria that start the disease or is it the host response that are and perhaps in the future maybe there's medication to modulate host response and perhaps to identify patient with implant have some disease later on. What's caused the result of care in the patient with perio. So that's all about perio. The next slide should be something on how to become a perio specialist. So during my time is a bit, I was a permanent officer in the KM, but in your case, perhaps after maybe you will get awarded select masuk as a permanent officer in KKM, or perhaps you're interested in joining the lecturer, becoming open up your private clinic. Because in my batch we have 5 of us from KKM. One of us is a training lecturer, and one of us is a private practitioner where she's currently have a own clinic. So in order to further study, you need permission employee. If you are the KM, you need cuti gaji. You need to have some scholarship, and basically your boss need to allow you to further. In order to fund your study, you need some money. Basically, in KKM we have specialty Hadi latihan persekutuan, or slash is basically from university, or you have tajak amara or any yayasan, or perhaps your own pocket money that you have. And then where to place it, local university or overseas university. For perio, the program are now doctorate in clinical dentistry in UKM and also UITM, where the first year is you should have your master in science, and then you will do a doctorate, which is equivalent to PhD for 3 years. So, but so far, from my knowledge, is USM is still adapting the master in clinical dentistry. So that we have 4 years of masters. UITM, 1 year masters, and 3 years doctorate. So bila you conform to, you should have the topic PhD. And as part of that, if you need to check with the MDC and KKM whether the university are or not. But for perio, the famous university in the UK is the ISMS Unwell 2 weeks ago, our husband. And also Hong Kong University, like Sedap, where she went. This is the European Federation of Perio Society. Overseas, the program is on 3 years because they full time of master. Malaysia is full time 4 years. But in my understanding, everyone that are graduated from university in overseas, they will at least 1.5 years, if I'm not mistaken. So a total of 4 years and a half to obtain to being recognized as a specialist. And then part of this other next. So like what, in order to achieve, in order to have been approved to be accepted into a study or being accepted, being award tajaan or HLP, you need to have a good attitude. I'm not saying that I have a good attitude, but I think we face a lot of trouble. I did a lot of mistakes, but we learn from it. And improve every day. And then in order to, because this program is mostly in English, so you have to have an English, for example, IELTS or WET. Even though my English is not that good as well, but this most study in English and then English. And then you have to go and attempt the exam, the MJDF or MFES or BMS. So having a good attitude, having good knowledge, then the thing comes to skill. The skill part is something that you after 1 year or 2 years, you can say that I will say even my skill during my time is partnership. I'm still not there. There's still need to more to improve. But having a good attitude, make you more resilient, can go further. Above that, in order to further study as well, you need your lecturer to as a referee. So having a good connection, connection with your lecturer may help you as well and be approved. Because, for example, you know that currently you are in final year. If you are very interested in value, you at this time actually you have to know your more interest, more your aim of interest. During my understanding, if I more into because our exposure in Peru during my year 5 is most of the time become so it's not, we are not that well exposed to it. So now you have my senior UN and Liza, a very good friend of mine. They will guide you if you are very interested. The attachment in KKM in your new program, it's very difficult to get a place in period. At least you have to work. When I attached in Kuantan, We have some endo officer that we attach there for 2 weeks in time. Dan Kuantan, paling besar. After the year of endo, then maybe you can apply for attachment with KKM, specialist as in perio setting. You get some exposure. Try to request lah. Okay, next slide. I think should be it. Okay, I think that's all. I would like to say thank you and all the best to everyone. Hopefully, you'll be happy soon. Find your passion. I mean, if you ask me, if you want to become a perio specialist, I will really encourage the lacking of perio specialists, especially young officers. The gap currently with the older generation and the young generation are quite large. So we need you to join us, join university as well, because I don't think we have that many lecturers in perio. And we also have the Malaysian Society of Periodontists. And as a lot of exposure, we have a mentor-mentee program as well. I mean, we try to push. And I'm looking forward for it. Okay, that's all for me. Either in Malay or English. Thank you.
Okay. Thank you, Dr. Hadi, for wonderful sharing. Now to the Q&A session. Audiences may unmute your microphone or directly to visit the question, or you may as well drop your comment.
Sorry kalau tak dengar sikit berangin sangat. Lepas tu saya cakap air sebab sini ada orang putih kan, takut dia tak faham semari nak saya cakap apa pula. Yeah, Hafiz.
Before you end your session, could you please show us around Copenhagen?
Currently, I'm in dekat kawasan bangunan. Kurang minat.
Kurang mengenal lah, Doktor.
Next session dekat Perio ni, dekat Vienna, Austria. Nak jadi Perio datang ke. Saya buat soalan kan, dalam Perio mungkin jelas konsep. Basically perjalanannya saya rasa Nazrin dan Hafiz nanti pun basically sama je perjalanan dia exam. Tapi kenapa choose bidang masing-masing tu berbeza lah. And information ni nampak memang diperlukan lagi. In terms of research and clinical tak ramai. Semuanya agak limited sebab bila perlu kepakaran. Macam kita dentist, kita kena kerja kena ada dental check, medical facility. Sebab ada benda yang kira jugalah. Ini dah kuasa kita. Tapi kalau korang kita akan berhenti lah.
Faham doktor? Rasanya macam ni macam tak ada soalan. So kita proceed to the next speaker. And Hadi for such a wonderful sharing.
Thank you.
Okay, so now we are glad to introduce our third speaker, who is also our clinical lecturer in prosthodontics, Dr. Siti Nadia, our profound alumni from the second batch, whom has vast experience in her postgraduate studies in prosthodontics. Thus, with much delight, let us Nadia Rahimi. Doctor, the stage is yours.
Assalamualaikum. Can everyone hear me?
Waalaikumsalam. Boleh Doctor?
Okay, that's good. Okay, Bismillahirrahmanirrahim. Assalamualaikum everyone. As dear seniors, you know, like I'm the second batch because we second batch rely on so much with our first batch because they are our like literally guidance lah, A to Z, right? Macam rasa kambing hitam tak, Hafiz? Macam awal-awal tu kan like banyak change. They tried this sort of curriculum to first batch and then later with our batch different. So I think like our bonding between the first two batch in terms of have to struggle the early phase of as the apprentice. However, I love and missing those moments during undergrad that you are like not fulfilling the requirement whatsoever you guys are experiencing right now. I totally understand because I have been in your shoes. Comparing your requirements right now compared to our requirement last time is like great distance lah. Like in terms of how many prosto requirements that you have to fulfill, not to mention the cons. Sorry tau, suara raucous sikit. Okay, so I'm going to share a little bit about my journey in prosthodontics. So this is my batch. We have like 27 students, only 5 males and 22 of us are female. We rely on each other. We studied group together like guys lah. Some of the discussion too we did together, but most of the study group for exam purposes in a small group discussion. And last time during our time, our faculty did conduct international visit to our batch. We did it in Thammasat University. I forgot our seniors. I think they went to Indonesia, right? Hadi and Hafiz. And for our juniors, some have gone to Korea and some have gone to Turkey, if I'm not mistaken. So this is the moment. If you notice here, and I think like this is Dr. Shatirah Najmi. And then this is the cultural event where we did performed di Barat lah, tak ada benda lain and they did their culture performance as well. So is a very momentable memory. And then there you go, then you get credit lah after all the obstacles and the struggles lah. So this is a must post for your convo photo later. Iqra punya teardrop . So briefly, I did mention in a very clear graphs, flow chart. Better to refer his. I just like briefly lah the pathway, like whatever Dr. Hadi had mentioned just now. So after you have finished your undergrad, you have to go for compulsory service in either KKM or just so you know that you can also perform your compulsory service in uni, but the protocols is a bit different. I'm not so sure how you can liaise with the university that you are intending to do your compulsory service and do new dental officer. Like last time during my time, it's still FIDO. Some for FIDO-ship is like USM, UIA. I think our university also accepting it, but I would advise for you to go in university, because it's going to be a very challenge. I mean, like change and environment, like comparing to hospital and non-hospital setting. Like our hospital setting, right? So it's quite a lot of limitation that you are going to learn. So many things missing. Okay, completed your compulsory service like NDOC, you can either go to 3 sectors, either in KKM, university, or private lah. So in KKM, it depends on what Dr. Hafiz has mentioned earlier. Like not everyone is going to be absorbed back. And then for uni, you have to search around and maybe expand your networking to ask for any positions available that the university open, because sometimes the post that is being opened to candidates is not being announced publicly, but internally, like within the dental clinics. So try to be active in gaining your networking. I mean, like you can be friends with colleagues graduated from UCAM, UITM, and so on. You know there is a post, you can try to apply for it. Make sure you have a good CV. So your good CV later, I'll good CV in order for you to secure a place or a post in university, as well as it also indirectly helps for you for postgraduate training. Okay, as for private, just like as long as you have money lah, basically to go for private dental sector. One thing is money, and second thing is knowledge lah, like how to set up your clinics. I think you have learned that as well in the clinical dental the private practice, right? So you best briefly know lah what you need to fulfill in order for you to open up a dental clinic. So in order for you to read, firstly you can start actually like during your undergraduate training. So during undergraduate training, you can start performing in your exams. Like try, I mean, like if not targeting distinctions, but at least like got pass and everything lah, and fulfilling all your requirements. Interesting cases, compile it properly with photos, and you can put your own logbook where to show later to your interviewers and you have done it. Okay, and then a must thing that the easiest thing for you to do while proceeding your life as undergrad, as compulsory services, you can join any conferences, any hands-on, any webinar properly. Okay, like initially during my time, to be honest, I start loving prosto since my year 4 undergraduates, but FIDO, which is end up now, you still want to explore what kind of specialty that you might be falling in love more. Okay, so CPD, I tend to just go to any that time there is no much of webinars. Most of it is conferences. I just go to any conferences. You have to invest, do not sponsor you to go to the conferences. So you have to spend your part of your salary to spend on your conferences fees. It might be hundreds, and depending on what kind of topic that you go to. And then towards the end, if you already see that which specialty that you are go more towards that. I mean, like, for example, like in my case, I love prosto, so I start going to prosto driven conferences, anything related. So endo is integrated, right? Closely related, just go. So you can still have like multiple choices there. This is just to show to your interviewers later that you have the passion in that kind, in that specialty. And then secondly, you can take basic science exam such as BMS. BMS can be LIR. And then previously they have MJDF, but based on my friend, it already like omitted. Then that is still available right now is MFDS part 1 and part 2. It's 2 components. The part 1 is one best answer is OSCE. So basically, once you have passed these 2 parts of MFDS, you are eligible to access to all the journal, library, and publication that is related to the membership diplomat. And then you also can consider taking IELTS. I'm not sure, because last time our time is still old. Also took MUET. Right now, I think it's better for you to renew it with IELTS to have a qualification in terms of English level lah. Okay, and then as I said before, it's logbook. Whenever you have a good cases or interesting cases, you can compile it off, record those with the steps, because this what you are going to bring during your interview. Okay, and then after you secure yourself in either KKM, uni or private, it's going to have like 3 lines right now. So for private, it's like straightforward because you are not related employer, so you can self-fund or maybe request your fund to pursue your postgraduate study under MARA or PTPTN, and then join university USIM as academician. So I am eligible for scholarship under Kementerian Pengajian Tinggi. We call it SLAB. They have scholarship for local and overseas university, but so unfortunately when I joined as a trainee last time, the scholarship has been, no, it's not available lah, basically it's not available, so I just applied for UiTM and I just got it lah. And for the KKM is a bit struggle, I think, to get the scholarship because it's based on seniority basis. So you have to really show doing all those I've mentioned earlier lah. Okay, but saying about the seniority basis, based on my observation in UiTM, like my colleagues, some of them not even like too senior to get the HLP. So somehow I think it is also based on rezeki lah. Rezeki. Quite young, still already got the HLP, but you have to reach certain batches of age during the HLP. So these are my compulsory services. Basically, it's the same thing like others. I've like selected a few je. Banyak lagi benda yang interesting. My leadership program, I was posted in Penang. I chose Penang as my first posting placement, and I got KP Kepala Batas. So basically, we have to serve the community. We go and give dental education talk to school, secondary school, as posting, is posting all the specialty. These are the lucky things about us generation, our generations last time. We have to go through all the specialty punya ample of time to explore what kind of specialty that we are driven to, because in undergraduate setting and working setting is not totally like great difference. Okay. So basically, like Dr. I like what Dr. highlighted earlier. Enjoy the process, be humble but not weak. It's true, because during my KKM time, it's the time where I stumble with lots of attitude and personalities, like in in USIM, like maybe among our friends we don't have much friendship, right? Colleagues relationship. But when you go into KKM, there are lots of problem in terms of like seniority and juniority. You have to tackle that. And then later on, cut short the story, I joined USIM as a trainee, and then I pursue prosto in UiTM. Okay, so once I had the scholarship, I cannot afford to fund myself. So basically, Alhamdulillah as well, I am so blessed to choose prosto, to pursue prosto in UiTM. I'm again the second batch, always second batch. So modules, and in my batch, these are my batch. We have 3 departments here, like four residents in per department. So these are colleagues, friends, and BFF whatsoever lah, because we really study together, we crack together, we laugh together, and everything. So during postgrad, what is interesting is like during postgrad, you are like you are adult student, right? So you are being exposed with dentists already, right? So you have more independency in terms of practicing your dentistry. So we are also taught photography, and then we are invited into Nikon HQ to learn more of the SLR, and directly from the Nikon professional can attend multiple conferences. That's why I said that even though you learn locally, I mean like you go training in local universities, you can still meet the gurus in prosto. That later when you start studying into training, you start knowing which one is a renowned author, right? Author or specialist. For example, like this one is Khalid Gurel. If you know FPT technique, I think I dah mula look for specialist punya team. But it's interesting, I tell you, like all these sifus, like gurus, they will start their presentations showing they have gone through in order for them to reach their position there. So it's really inspiring. So don't afraid to spend your money on conferences. Even like these conferences, I have to pay myself 2,500 just to attend his talk. But after hearing directly from him, then before maybe you read the paper, you just like tak ingat. But because of the author himself presented directly in front of you, so you remember his paper, and you can excel in your exam as well. Right? Okay. Next, during postgrad training as well, we are also invited to go visit Dentistry Sirona, Thailand, where that time they just launched this Optimus, apa nama dia? Optimus Prime Scan. I got my friends scan. So this is the latest CERAC system that are available in the market. That time it is just launched like 2 months like that. So opportunity for us to be able to be exposed with this kind of digital technology, and we did a trade part of jalan-jalan lah, like Dr. Hadi just now. You see that he went to conferences and then got the opportunity to spend the time with family, to go jalan-jalan there. Okay, so other than that, of course, this is the most important thing, the clinical training. you learn how to improve the smile, so how to do implant placement, then restore it, and then how to decide restorability, whether this so implants and all those typical prosto things. More interesting for me, I think I found this more interesting to do maxillofacial processes. Instead of doing processes intraorally, you expand your skills and experiences by restoring and rehabilitate extraoral. So this was my patient. He actually has passed away due to cancer. So he suffers from cancer. I think, like, if I'm not mistaken, it's something about squamous cell carcinoma as well. Oh no, basal skin punya cancer tu, Nadia. Basal cell carcinoma. Yes, basal cell carcinoma. So we did orbit processes and we issued it. This time is during the try-in. So the color is not yet colored properly, but in terms of this I love, like carving, you have to copy the contralateral eye, the shape, how the orbital should be, how the pupil should be seen. This this border with a spectacle. And then next cases, this is more common rather than extraoral defect. Like, for example, this is also a deceased patient. He has passed away, and Alhamdulillah, I got to issue his case like he passed away, and I've won several presentations with his case alone. So this basically a maxilla where he had, I think, like almost every of the maxilla with only remaining right maxilla tuberosity. This is how the extraoral view looks like with lip scarring, and this is how I restore it with complete dentures obturator, basically. How you want, so I learned here how you want to tackle the complete denture, because you imagine if you want to restore high up to the nasal area, this is the nasal cavity area, it's going to be quite heavy. You have to learn how to make your denture hollow inside. So there is a hollow bulb inside the denture in order for you to reduce the weight, make the patient more comfortable wearing it. Okay, during the postgrad as well, you can also attend multiple conferences, symposiums, presentation, and so on. Actually, like, I am not so rajin as well. But our lecturers in UITM conferences, so we have to. And Alhamdulillah, when we join anything, just enjoy the process and do your best. Dapat menang ke tak menang ke, that's the bonus thing. Okay, so this is the case that uncle earlier. The whole, Alhamdulillah, I won the first place in case report presentation, and then later I also joined conferences to present my small reach that I've done in UITM as well. Alhamdulillah, this is not to brag, it's actually disclaimer, just to like let you guys know, anybody lah. Okay, learning is fine. What I want to tell, actually, learning is fine if you really enjoy it, and you can do it. Actually, so even this one is really shocking, Azhar. I've won first place presentation for original research in Asian Academy of Prosthodontics was done biennial. It means like 2 years, once in 2 years. So during that it was held in Malaysia. So I presented there. Alhamdulillah, I won the first prize. And also there is a special award by Kim. Kim is like the specialist in Japan. So Kim initiate this award. So I got, berapa yang aku dapat? 50 USD. Banyak tak tu? 50 USD. And then a part of that, during my third year or fourth year, if I'm not mistaken, I joined the 3-minute thesis competition. I won the second place. This is my beloved supervisor, Prof. Rohan Ahmad. Okay, next. Oh, I think it's the end already. It's the end. So this is the conclusion. Is the sweet thing in the postgrad and undergrad things. Of course, whatever you've gone through, you will even I think I just report duty. This is my third month in USIM. I've met like 2 students already came to me. Who you are? It's okay to do that because I've been there as well. I've cried a bucket. Even I love prosto. It's so you have laboratory works, you have to handle your patient's appointment, you have to handle your clinical works. But just remember that you have Allah. Allah ini kat tangan, akhirat dekat jiwa. So if you have a very good dependency in Allah, insyaAllah you can go through everything. Percayalah, macam bantuan Allah tu akan tiba dalam keadaan yang tak disangka-sangka. It really happens. Like, to be honest, like I'm not saying that I memang baik tak. Benda ni kan iman kan naik dan turun. So, but it really happens. Sometimes kan macam you dah lost your, macam contoh, patient you keep issue or you dah issue, tiba-tiba patient meninggal pula, you tak claim lagi requirement tu. That sort of thing happens not only to your batches, also to our batches during postgrads. You dah nak buat full mau rehab ni, you dah ambil record semua, lepas tu you dah send to the lab, just tinggal nak issue je. So mau rehab, thousands ringgit of works. You want to issue and the patient suddenly die, heart attack, playing badminton, like that's so sudden. Tapi you have to like Dr. Hafiz said earlier. Okay? And then secondly, what I want to highlight is berkat. Berkat ni is how you are being respectful towards your trust. Like trust important as well. Because sometimes you overlook over these things. And technicians also helps you. They are also your lecturers. They are also your teacher and friends. So hasbunallah. Bukan hasbunallah. Apa nama?
Habluminallah, habluminannas.
Yes, thank you. Habluminallah, habluminannas. Thirdly is passion. I letak passion nombor 3 sebab like I said, passion. I got passion, kan? Passion. Tapi I juga nangis. I juga question myself. Tapi you have to remind yourself back. Oh, I really love restoring patients' mouth and make them happy. Like it's really satisfying after you have completed a smile to patient, you rehab the case. So when you see patients happy, you satisfied. So you love your job. Tapi nak achieve that, you have to go through all the struggles lah. But just enjoy the process. I am learning. Okay? And love what you do. Otherwise, it's going to be mental lah kalau you tak mental health lah, basically. Okay, next is right attitude. Right attitude is like you need to have the attitude of wanting to learn. You have at the same time humble and not weak, like Dr. Hafiz said. I really like that sentence, humble but not weak. Sometimes if be overconfident as well. Do not be overconfident, but do not be underconfident. Bersederhana lah. Okay. Number 5 is perseverance. It's okay to fail. You just need to, like, after you fail or you sad, it's okay to cry dulu. Lepas tu, talk to him and then back up. Okay, like the stone jatuh kan, bola jatuh, so kena naik balik. This is the advices to myself as well. Kan determination. This recipe ni is not only for pursuing your postgrad study, it's also throughout your life. Okay, so this last thing, so if you think maybe year 5, possibly sebab dah SEM 2, nak end of year, mungkin banyak benda nak kena kejar. List, do a mental the clutter, write it down. Okay, if you have like a very cluttering mind, put your thoughts, and then after you list down your thoughts and prioritize it. And just focus on this. Because I tend to like overwhelm myself as well. Like, banyaknya benda nak buat kan, you list, lepas tu endingnya tak buat apa-apa sebab stress sangat. Tak jadi apa-apa. So that is all from me. Is there any question? I apologize in case I've done lots of mistakes with you guys in the clinic or everywhere. I apologize. What is done is meant to improve yourself, and I really hope all of my students gonna best colleagues later, maybe specialists, inshallah. I pray for you guys, inshallah. Okay, that is all.
Amin for the thank you, Doctor.
Macam mana nak end?
Thank you, Dr. Nadia.
Oh, I dah finish off everything lah.
Thank you, Dr. Nadia, for such clear and bright sharing. So now let us move straight to the Q&A session. Since if you have any question, you may unmute your microphone and directly deliver the question, or you may as well drop your question in the chat box below. Ada yang ada soalan ke? Doktor, ada soalan daripada WhatsApp. Doktor dengar ke? Doktor, saya bacakan soalan. How did Doctor got the courage to explore and be confident in trying in competitions? Doktor dengar ke soalan tadi? Doktor,
Cakap seorang. Boleh repeat balik tak?
soalan dia, how did doctor got the courage to explore and be confident in trying in competitions?
I think like to begin with, I am blessed and very lucky to have very supportive lecturers lah, starting from undergrads. I think like supervisor is Dr. Nolela. You guys know her, right? Sebab kan dengan Dr. Nolela. So Dr. Nolela is my research supervisor. Oh, see, even the topic of very prosto driven since from the beginning lah. Tapi not necessarily you all to have go through that lah. It's just that my own journey. So like Dr. Lela, he would lecture, and she is the one who I think who believe in me lah. Dia yang register for me. I think my Asian Pacific Dental Conference. Okay, you guys can buat symposium tu. You guys ada final year project, right? From that final year project, you already have your poster or oral presentation. From that oral and poster presentation, you bring it to outsource of send it to NDSSC, right? The National Dental Student Scientific Conference. That's where you start grooming yourself as a speaker, as a presenter. So you are being forced lah to begin with. Lepas tu, lepas join NDSSC, you join lah FPDC. So benda tu develop. Benda ni. Lepas tu, Dr. Nadia, how does it feel to return back to your study place as a lecturer? Is that I think like it is fortunate and unfortunate. The fortunate thing, because I know A to Z, because I'm a student there. So if you guys do like some tricks, I know, because I've been through what you guys are doing, okay? Semua selok-belok tahu. Kan Hafiz kita 2 batch je, hantu semua kat situ, Ghafur semua ambil attendance hantu kat situ. Ghafur ambil attendance, Hafiz tolong buat roll call malam-malam dengan hantu tu. So kita orang second batch ni dengar je senior kata apa. Ada orang tu memang kepala lah tu, Dr. Hafiz and Dr. Ghafur tu. And apa lagi tadi yang aku dah merapu dah. Looking back in terms of as a colleague, I think that's a barrier there a bit, because you work with your lecturers, right? I feel the barrier there. I don't know whether that's a good thing or that's a bad thing. As for now, I take it as a good lah. Think positively. Like, for example, teaching me in terms of like research wise, like, as academician, it's not only teaching you guys, there are lots of multiple things that we have to do, like documentation, banyaklah benda as academician, mainly is research lah. Sometimes I miss being in KKM. If you guys are like clinician driven, it's better for you to stay in KKM, but you have to weigh the cons lah, like you have to really fight and really compete for the scholarship. Is there any other question? Garang ke? Saya tak rasa saya garang. Garang ke?
Ada soalan lagi ke? Okay. Kalau tak ada, we proceed to the next speaker. Thank you, Dr. Nadia, and right sharing. Now we have come to our final speaker, whom will be sharing with us on his journey pursuing postgraduate studies in Coming from the 5th batch of FPg USIM, Dr. Muhammad Nazrin Muhammad Isa is currently studying in endodontics in UITM. Without have Dr. Muhammad Nazrin to share his terms with us.
Hello, Assalamualaikum everyone. Apa khabar semua? Dengar ke? Hello?
Dengar doktor.
Dia nampak slide tak?
Nampak Dr. Nazrin?
Thank you Kak Nadia. Allow me to speak in bahasa. Thank you. This is a career insight, the planning your pathway in dentistry, specifically in endodontics. Saya memperkenalkan diri saya. Saya Muhammad Nazrin Muhammad Isa. I'm a 5th batch. So saya sempat jumpa Dr. Hafiz masa tu dia final year. Kak Nadia time tu dia 4th year. So let's begin. So this is my batch. I'm starting from 2000. So I'm a 5th batch. Batch yang kelima. So this is program. Dan 2016 saya 2017 sampai 2018 saya merupakan second batch new dental officer program. Time tu saya di Kemaman Terengganu. So macam iaitu attachment iaitu di pediatric dan juga di oral surgery. So yang ni gambar ni acah-acah je. Sebenarnya saya buat satu take over case. Okay. Lepas tu saya endo 1 tahun saja. Actually tak cukup tak sampai 1 tahun, 8 bulan lebih je. Lepas tu saya resign setahun, lepas tu saya resign daripada KKM. Saya masuk USIM sebagai dental officer, bukan lecturer. Sebagai pegawai USIM. So daripada 2018 sampai 2021. Kemudian saya apply untuk sambung belajar postgrad endodontik di UITM. Sebelum tu program pergi design kali kedua sebagai pegawai pergigian di USIM. Kemudian saya sambung belajar di UITM under private calon persendirian. Meaning that kita pakai my own money lah untuk sambung belajar ni. So let's begin. So what is the endodontics? Perkataan endo ni actually datang from the Greek. Endo which mean inside, dontic meaning the tooth. So it's anything that we are talking about the pulp inside the tooth. So what the scope of treatment is endodontic, this banyak juga scope dia, antara adalah vital pulp therapy, regenerative, non-surgical root canal retreatment, surgical root canal treatment. Currently dia ada satu guideline baru dikeluarkan pada AE 2019. In case of kalau case tu is diagnosed with irreversible pulpitis, it's not necessary to do root canal treatment. Instead, you can do the anatomy. For example, for this case, I think this case was diagnosed with irreversible pulpitis, and then the case that managed, not necessary to do root canal treatment. For example, this is my case. Kita can see the pulp, the reach with the blood, meaning that it's still healthy. Infected pulp ataupun inflamed pulp, leave it the healthy pulp. So ini endodontic juga, kita boleh buat case of regenerative endodontics ni. Dia ada matured teeth, unmatured teeth. Kemudian we do regenerative, then after several years we can see the fully form of the root. Kemudian dalam endodontic juga macam kita selalu buat adalah root canal treatment lah, dan surgical root canal treatment. For example, this my case after then we did the heal after 6 months. Kemudian we handle with the severe curve of then we handle about the apa nama fractured instrument. We can bypass macam kes-kes yang kita buat rawatan akar tiba-tiba patah dekat dalam saluran akar, dan juga kita handle kes-kes macam tu, kita keluarkan file yang patah tu, ataupun ada certain kes macam kes ni dia ada 2 file patah, satu file patah kita keluarkan, saya keluarkan file patah dan I just retrieve dia, still achieve the purpose lah, to debride apa nama saluran akar tersebut. For example juga in case of root canal treatment, kes-kes yang kompleks, file patah juga dekat hujung kat sini, lepas tu berat gigi tu dia bifurcate dekat middle third of the roots. This got under endodontic juga buat mana kes yang severe calcified, and then I made a mistake, kita perforate sebab dari gigi ni kita terperforate. So bila kita terperforate, we need I managed to bypass, and then you can see the bone heal after 2 years. And then dalam endodontic juga dia ada non-surgical root canal treatment, meaning that kalau kita dah buat rawatan akar sebelum tu dan dia fail, kita boleh buat semula rawatan akar C-shape canal. Kemudian kes ni dia ada reinfection, kemudian kita buat semula dan kita tengok dia heal after 6 months. And then endodontic, and then intentional replantation juga, contoh macam kes tu dia rawatan akar dia fail, kemudian kita tak boleh nak buat orthogate retreatment, kemudian kita letak balik dalam soket tu. So how to pursue study in endodontics, yang ni rasa ramai dah sebut dah, macam Kak Nadia dah sebut, sebelum dah sebut. So saya rasa saya tak perlu nak cerita lebih lanjut, tapi cuma saya sembang dari segi sebab dari segi bagaimana dari skop private lah, dari skop kita sebagai calon persendirian. Sebab kebiasaannya kebanyakan postgrad ni mereka datang daripada trainee lecturers, datang daripada AMI juga, tetapi tak ramai sebenarnya datang daripada private ataupun calon persendirian. So kita pasal endodontik ni, untuk kita betul-betul nak mendalami endodontik, dia tak semestinya untuk menjadi pakar, boleh juga hanya sekadar kita mendalami endodontik tu. Tapi in case kalau nak jadi endodontic specialist, then dia punya laluan ni adalah seperti yang speaker ni telah sebut lah. Ini semua lebih lanjut. Tapi cuma untuk private candidate yang paling penting is the financial support lah. Sebab kita tak kerja, so kita nak kena cari duit untuk bayar yuran, dan juga cari duit untuk bayar kita punya komitmen, makan, kereta kalau yang dah berkahwin. So itu challenging dia, financial support. Dan kebanyakan setakat ini, mereka yang sama belajar sebagai calon persendirian ataupun mereka kebanyakannya ambil daripada tajaan MARA. Tapi MARA dia bukan bagi duit tajaan 100%. Meaning that after kita finish, still kena bayar balik lah. Lepas tu kita punya cabaran ni sebagai private candidate adalah untuk kita antara kita punya belajar dan juga kita punya kerja. Kita punya belajar dan juga kita punya nak cari duit tu. Sebab kalau kita belajar, tiba-tiba kita tak ada duit, kita nak makan lagi, kita nak bayar rumah lagi. So kita nak kena balance kat antara dua tu. So itulah cabaran dia. Terutama sekali tentang financial lah. Terutama sekali untuk calon persendirian. So personally, is the best way to progress in endodontics. Kalau ada sesiapa antara kalian yang berminat untuk sambung endodontics ni, apakah formula yang saya boleh bagilah berdasarkan pengalaman saya lihat kes-kes yang saya tunjuk tadi, bukanlah kes yang terbaik pun, ada banyak lagi orang buat kes yang terbaik tu pun. Itu semua kes-kes yang saya buat sebelum saya sambung kepakaran. Saya dah buat kes tu. So sebenarnya kalau saya boleh buat dan kalian juga pun boleh buat juga, tak ada masalah. Boleh buat juga kes-kes macam tu. So resepi dia adalah kita kena mesti ada 3 benda. Perkara ni saya dapat daripada saya punya mentor lah. Mereka sebab sebelum saya boleh jadi minat dalam endodontik ni sebab saya cuba guide saya. So antaranya Dr. Imran. Dr. Imran tu sebut, dia kata kalau kita betul-betul nak progress endodontik ni, actually kita mesti ada 3 benda. Pertama, kita mesti ada apa yang kita buat tu. Yang kedua, kita mesti ada alat-alat. Sebab untuk buat endodontik ni, dia punya alat dia agak sophisticated sikit dan alat dia agak mahal juga. Dan yang ketiga, flow yang bagus ataupun mesti ada jumlah pesakit yang datang dekat kita, ataupun dalam arti kata lain kita kena banyak buat kes lah baru kita boleh pandai ataupun kita boleh grow dalam endodontik. Kalau kita tak ada knowledge tapi kita ada equipment, dan kalau kita ada patient flow tapi kita tak pandai, kita pun tak boleh buat endodontics. Kalau kita pandai, kita ada patient tapi kita tak ada equipment pun kita tak boleh nak grow. Dan kalau kita pandai, kita ada equipment dan patient pun tak ada, kita pun tak boleh nak grow endodontics. So ketiga-tiga ni, knowledge, equipment, patient flow ni kita kena ada lah. So regarding the knowledge and skill, saya rasa faktor paling utama yang menghala saya ke arah endodontik lah mesti kena ada. Mentor ni kena someone yang very inspiring you. Dia memahami kita dan kita juga memahami dia. It's very inspiring you. Dia boleh share, dia boleh menunjuk elok dan apa juga yang buruk. Bukan hanya semata-mata dari segi endodontik, tapi juga melalui laluan hidup kita. Untuk kita memilih apa yang baik dan apa yang buruk dalam hidup kita. Kedua adalah kita kena luaskan kita punya social kita punya lingkungan sosial kita. Sebab kita jangan suka terkongkong dengan satu tempat kita yang kita comfort zone. Kita kena cuba berkawan dengan seramai yang mungkin orang. Sebab kita tak tahu di satu saat nanti bila kita susah, siapa yang akan tolong kita. Yang ketiga, untuk widen your knowledge yang bagus juga, kena hadiri banyak conference, kena hadiri banyak workshop, kena banyak bersacrifice keluarkan duit untuk attend semua conference dan workshop ni, dan baca books, artikel. Dan the good things in endodontic is kalau macam department lain, kita susah kita nak mimic in clinical situation. Sebab kalau macam case perio dekat yang on model, sebab dia tak sama. Tapi kalau an extracted tu, dia mimic almost 80% untuk kes yang kita akan buat masa dekat alam mulut patient nanti. So that type of the tooth yang kita boleh buat sebanyak mungkin untuk kita pandai dalam extracted tooth ni. Saya pernah tanya Trauchi tu merupakan seorang sifu besar lah dekat dalam endodontics, terutama sekali case file retrieval tadi. Macam mana kita nak keluarkan separated instrument. Dia kata at least untuk saya tanya dengan dia, macam mana untuk saya lebih berkeyakinan kes-kes file yang patah. Dia kata at least you kena practice 40 case of file separated instrument baru you rasa lebih confident. So the more you practice, the more confident you will become. So this is my mentor lah. Sebab the first is Dr. Aus lah. Dr. Aus sebab dulu masa saya dekat USIM, every week once a week saya akan attach dengan Dr. Aus. Dia buat root canal treatment, so every week tu saya akan assist dia, saya akan tanya dia. So actually Dr. Aus is my first mentor. Ataupun dia kata dia merupakan pencetus kepada semua minat saya, terutama adalah minat endodontics, which mean apa yang saya tak tahu dia share, dan dia approachable, dia individu yang very humble. Dia tak memandang rendah kat kita. So kita feel confident dengan dia, dan dia pun okay dengan kita. So everything yang I tak sure, I tanya dia. Even I nak sambung belajar pun, saya minta second opinion daripada dia. Walaupun mula-mula dia agak kurang bersetuju untuk saya sambung belajar sebagai private candidate kerana melihatkan kepada banyak kengkangan ataupun isu terutama sekali financial support. So apabila saya lay out my plan, so dia pun okay, dan everything insya-Allah akan okay lah. So this is contoh tahamu from Baghdad. This is Rikuchi. So kita attend banyak conference to gain knowledge lah. This is example Dr. Imran, this is Dr. Haikal, this is Marino Sutejo, Ricardo Tonini. Semua ni I attend before I sambung belajar, 2-3 years back. dekat NCS dekat Kuantan. This is all great gurus ataupun great mentors yang kita mesti tanya dia, kita jumpa, kita tanya dia resepi kejayaan supaya lebih inspired kita. Sebab kita bukan selamanya kita akan rasa bersemangat, ada masanya kita akan rasa lemah. Tapi hanya kalau kita dapat melihat, kita akan jadi lebih kuat dan lebih gagah lah untuk hadapi hidup ni. Ni contoh saya buat call dengan Martin Leven. Martin Leven ni merupakan Dean Counsel daripada Pennsylvania School of Dental Medicine. Antara guru juga dalam CPCT in endodontics. So I juga tunjuk program which is kita akan share kita punya case untuk kita lebih bersemangat dalam endodontic ni. So this is no matter how good webinar you take, you cannot master them. And Umar Ikram pun pernah ada sebut, dia kata dentistry is a manual job and requires good dexterity. This manual skill cannot be acquired by reading books. So put the hours in at work but balance this with downtime. Must practice. So this is my journey masa sebelum sama belajar, macam mana saya develop saya punya minat, dan kemudian saya join banyak workshop, puluhan ribu untuk attending workshop. Even saya beli saya punya alat tu sendiri. So bila saya locum, saya bawa saya punya luggage. This is example practice kan, practice contoh file yang patah, kita pun boleh buat, tak ada masalah. You all pun boleh buat with good knowledge, ada experience pun boleh buat, tak ada masalah. Yang kena ada juga selain daripada knowledge adalah walaupun kita pandai, tapi kalau kita tak ada equipment yang sesuai untuk buat rawatan akar ni, dia sangat sukar untuk buat. Rawatan akar itself is very difficult, very difficult. So with a proper equipment kita boleh handle dia. So semua ni adalah barang-barang yang saya beli sendiri. So keseluruhan saya beli sendiri sebab bila kita pergi locum, kita tengok ada certain barang tu yang doktor tak mampu nak provide. So bila ada kes kita jadi susah. Bila kita susah nak buat rawatan akar, saya beli sendiri semua. Even X-ray punya sensor pun saya beli sendiri. X-ray punya sensor saya letak dekat klinik dia, dan saya beli loop juga. So benda ni saya akan bawa ke kes untuk rawatan akar. So saya lebih confident untuk buat kes-kes saya. Dan kalau bertanya dengan saya apa equipment first yang you all net tentang endodontics adalah magnification ataupun loop. Kalau nak kata beli mikroskop terlalu mahal. Kalau kena start dengan loop mahal. Satu survey conduct by Brown et al ni dia tunjuk bahawa antara faktor yang paling banyak menyebabkan general practitioner masalah musculoskeletal. The majority yang pincin awal adalah disebabkan masalah musculoskeletal. Sebab tu adalah penting kalau kita ada have a good posture, dan juga kita boleh buat kerja dengan lebih selesa. Sebab kalau kita nak buat kes rawatan akar ni, dia punya working field is very narrow. Untuk kita, kalau kes-kes straightforward, it's okay. But kalau kes tu macam very calcified canal, kita tak nampak, dan perlukan magnification. So kalau betting, you need to invest on the magnification, which is maybe can have a loop first. So for example, for this case kan, this is example of case molar. First molar usually about 70% of the population got second mesobuccal canal. Maksudnya MB dia ada 2 canal. So ini even kita nampak bawah mikroskop kan, kita tak nampak ada dekat sini. Tetapi by looking dengan kita tengok dengan dia punya mapping dia, kita boleh agak ada satu. Tapi cuba bayangkan kalau kita tak ada magnification langsung, rasa agak kita boleh nampak tak mapping ni. It's very difficult. For example, kes ni pula second very banyak pulp stone. So untuk kita buangkan dia tak boleh pakai ber, sebab kalau kita pakai ber they have possibility untuk dia perforate lah. So kita kena buang perlahan-perlahan sikit-sikit. Tapi kalau nak buang perlahan sikit-sikit pun kita kena nampak betul-betul kawasan tu. Then last kes yang dia bifurcate ataupun gigi tu satu, kemudian dia pecah dekat ujung ni 2. Kalau kita pakai naked eye, kita hanya boleh nampak dekat ujung ni. So kita kena pakai mikroskop baru kita boleh nampak sampai hujung ni terbelah 2, baru kita boleh clean and shape. And lastly, mesti good patient flow. So kalau you ada equipment, you tak ada pesakit, itu pun susah juga. So kena ada pesakit yang willing untuk buat rawatan nakar. Supaya kita banyak kes buat rawatan nakar, kita akan boleh excel in this. I think that's all. Masa pun sudah lewat. So ada apa soalan?
Thank you Dr. Nazrin. So kita buka untuk sesi soalan jawab. Dekat chat box macam ada soalan daripada Dr. Nadia. Dr. Ring, apa pandangan Dr. mengenai lupus Shopee? Okey tak?
Sebelum saya beli loops tu, saya ada try banyak loops. Cuma sebab kita nak beli satu benda tu untuk bertahan lama tau, untuk pakai satu tempoh jaga masa lama tu okey, tapi cuma isu dia kita akan jadi cepat pening. Kita jadi cepat pening. Mungkin mula-mula nak beli tu boleh lah, tapi kalau personally untuk diri saya sendiri, saya akan invest satu duit yang banyak. Contoh, sebab loop yang saya beli tu magnification dia 5 times. So harga dia agak mahal lah, dalam 10,000 plus lah. Tapi dulu lah masa ada duit, sekarang dah tak ada duit, so tak boleh beli lah. Boleh terus beli yang mahal kot pada pandangan saya, sebab kita nak guna pada waktu yang lama je. Just my personal preference lah. Cadangkan loop yang paling murah sebagai permulaan. Loop paling murah sebagai permulaan setakat ni lah. Dia kena ada balance antara dua lah kot. Kalau saya nak kata nak beli loop yang saya pakai pun kurang mampu kan, sebab ada komitmen masing-masing. Dia kena ada lebih, kita pakai tu kita selesa dan harga dia munasabah sikit. Saya dah tengok, saya rasa adalah loop yang okey lah, Zoomax saya rasa. Kazais pun boleh, Kazais pun actually good. Dia punya, kalau kita nak pakai loops ni, ada beberapa faktor. Pertama, harga. Kedua, yang penting juga the clarity of the image. Ada loops yang kita pakai, kita nampak blur tau, dia tak clarity. Yang ketiga, bila kita pakai, kita rasa selesa. Benda ni kita kena cuba ketika harga yang bagus lah. Saya pakai brand apa? Saya pakai brand Pentex 5 times. Tapi untuk starter, better kena ada magnification. Nanti dah lama-lama sikit, cuba try perlahan-lahan buat dengan microscope. So kita boleh lebih appreciate apa yang kita buat. Sebab kalau kita buat tanpa secara membabi buta, kita tak sure apa yang kita buat tu betul salah. Menjawab persoalan kebanyakan attendance, participant ke? Sebab saya cuba bawa perbincangan kita ni ke arah yang lebih so semua orang boleh faham kan. Kalau saya cerita benda-benda yang berat-berat tentang tu, tak masuk saya, sebab you all masih lagi kalau ada apa-apa persoalan, boleh tanya saya terus direct kat mana-mana. You boleh follow me dekat, banyakkan saya share kes kat situ, dan kita boleh bincang kes supaya kita lebih, bila kita bincang kes kita, kita share kes kita jadi lebih minat tu semakin bertambah. Okay.
Ada lagi ke soalan daripada audience? Okay, kalau tak ada soalan. Thank you Dr. Nazrin for such an amazing sharing. So, dear audience, these 4 sharing great speakers have been nothing but such an eye-opener and delightful insights for us. Again, we would like to greatly thank our 4 delightful speakers, Dr. Hadi, Dr. Nadia and Dr. Nazrin, for the astonishing and clear insights today. We have high hopes too that this event will help us, the students, the pathways in dentistry after we have graduated soon. Thank you to our various audiences for your participation and attentive engagement. So therefore, without wasting any more time, we would like to humbly invite all the doctors and the students to turn on their cameras for our photography session. Tunggu. Ada lagi ke yang nak buka kamera? Okay. Okay. Kita ambil gambar. Okay, 1, 2, 3. Okay, sekejap. One more time eh. 1. Okay, one more time eh. 1, 3. Alright. Thank you, doctors and audiences. We end our session today with a civil kafara and suratul as. Audiences, students, don't forget to fill in the attendance form. So thank you.